Hi, my name is Kristen Malafchak. I am an advocate for Disability Rights Michigan, which is part of the MVP partnership. And I have a disability. I've been a wheelchair user for my whole life. And today I'll be the facilitator of this listening session.
My name is Jamie Jr. I am a disability rights and social economic justice advocate. I have cerebral palsy, and I've used that wheelchair consistently for the last 8 years.
Hi, my name is Shantae Favors. I'm currently Miss Wheelchair Michigan 2024. I am a disability advocate. I've been using a wheelchair now for 6 years in July due to a spinal cord injury.
Hello, my name is Julia Hernandez. I am the mother of an adult man with multiple disabilities, and I will be speaking from a parent perspective. I also work at the Michigan Developmental Disabilities Institute as a research assistant.
Hello, my name is Barbara Dagger. I work for MIUCP. I am a self-advocate, and I've been using a chair for 5 years.
Hello, my name is Tony O. Graves. I am a person with a learning disability, and I have been advocating for others and advocating for myself since I was at the age of 5. So I'm glad to be here.
All right, number one. As a person who has a disability, what challenges have you experienced in accessing high-quality healthcare services that are not typically experienced by those who do not have a disability?
First and foremost, I feel exclusion. There's the lack of accessibility, so when you lack accessibility, you're excluding from the narrowing of the doorways, the lack of ramps, the examination rooms not being able to fit. I personally had to leave a very good urologist because I couldn't access the door, and then when someone opened it up, I didn't have access when I got in there. So my condition got worse because I couldn't see this doctor.
And I can piggyback on that also because I have a hard time walking a lot. So it's very hard for me to get the door or speed up because I'm not really able to walk as fast as I used to be anymore. That's because they said I have real bad feet, or that's part of who I am. But I can actually agree. I had to leave an orthopedic surgeon because it wasn't accessible for me.
Yeah, I can definitely relate. As a female, going to the doctor for typical obstetric and gynecology examinations are really hard because not only are the rooms inaccessible, but a lot of doctors are not experienced when it comes to individuals with cerebral palsy because of the way that my body is. My center of gravity is very narrow, so I have to, they have to be patient. They have to take their time. They have to negotiate my body, so that creates an issue, and that actually that difficulty extended to the birth of my son. I had issues with going into labor early and being in labor for an extended period of time before they even found out because I have cerebral palsy, I have really bad spasms. So when they told me to think about something that felt like a menstrual cramp, well, the way my body feels on an average daily basis is probably the way someone feels with a menstrual cramp. So I had no frame of reference. So my body was contracting for a good part of my pregnancy.
I can definitely relate to that when it comes to not being aware, properly trained. I have a Bafloquin pump for spasticity. I treat at a certain hospital, and I was out of range. I live not near the hospital, and one day I had a medical emergency, and 911 had to be called. And when I got to the hospital, I almost felt like a foreign in just a desert island with no one recognized me. I felt that day I felt really low. I felt extremely low. But to the point that I had to call another doctor from Detroit in order to get me that proper care. So the lack of training, the lack of understanding, not even wanting to learn, like not wanting to listen to the patient. So I can definitely relate.
I think one of the issues is that they don't know how to relate to a person with a disability, and they are not trained to actually handle the different challenges that we go through with disabilities.
My problem hasn't the doctor so much is like lab people, X-ray people, nurses. They just don't understand. They want to talk to the person with, like, did you know when her birthday is? So, I know when my birthday is, but the always has the verbal one.
I can agree. I can agree.
So for myself or my son and I, since English is my second language, understanding the language, English, and then understanding the medical language was a totally, I thought, okay, once I learn English, I'll be okay. And I started going to more and more doctors with my son, and it was like a totally different language. And I was like, oh, okay, I have to start all over because I need to learn what all this means. And it was interesting to find out, you know, that it's just a very different form of communication.
The Black Language Term. So I didn't mention this in my introduction, but I'm a former director of care. So I have that lived experience as well as that professional, right? And so I think what it comes down to is communication, right? And it seems to lack that. Like sometimes they speak at you and not to you.
Yes.
And back to what Barb was saying, sometimes they take we know a physical disability can manifest to a mental, right? But sometimes they make it cognitive, like you don't know, like she said. You see someone that's physically disabled, so maybe they don't understand.
Right.
Maybe they lack the cognitive. So that is something that they really need to get a hold of.
Exactly. I don't believe that they understand that our disability doesn't define who we are. We are individuals just like any other individual. I don't think a lot have been trained or have been experienced, so they take the disability like, oh, we need to help you. And from a person with a learning disability, I was told at work that he always gonna need help. And I said, no, I don't. I can handle it on my own. But that's the stereotype people get when people think because they have to have a disability or to receive things.
Yeah. Yeah.
But this is great discussion so far, everybody. And that was only question 1. So I'm going to go ahead and move on to question 2. And there may be some overlap in these questions, and that's okay. If we end up not taking as long on some of them than on others, that's fine. Okay, so question 2. In medical settings, what aspect of your overall care and well-being are most often overlooked by healthcare professionals?
So if I can take this, begin the conversation, I think for me, what's overlooked is my wellness. And I'll say wellness because my voice, you listening to me to understand how best to treat me. Because even though you're a medical doctor, I'm the expert in meat. Even translates to your children. When my son was young, I knew that something was wrong with him, but the doctors would not listen to me to the point where I had to get someone else to come with me to the physician appointment to say the exact same thing that I said to the physician for them to take us seriously. So that impacted, my child's wellness for a good portion of his growing up. He suffered needlessly because the doctors didn't want to listen to me.
That's not.
I want to say something positive. I have a neck thing going on too, and they did an MRI and stuff, and they sent me to a neurosurgeon at the U of M. He told me that if I didn't have surgery, I was paralyzed. I had surgery. He was wonderful.
Absolutely.
And I'm 7 months after surgery and everything good. So you said that, and I had the same thing.
Yeah, that's called listening to the patient, listening to science. So just like they hadn't delayed, that it wasn't a delayed diagnosis, it was a lack of care. So
Yeah.
that's what tends to happen. Like a lot of times people, so now I've joined the group of disability, and now I can't walk, I can't dress myself. I was a director of care, so I overseen 75 plus individuals care, assuring them to have dignified quality care to needing total care. So it's like, if I had that neurosurgeon that day that you had, I probably wouldn't be there.
Yeah.
So there are some great ones, because I have some great things to say about my PM&R doctor. He's amazing.
Yeah, I think as a professional, also working in the disability community, from what I've seen and advocated for, they've always looked over because they feel that they always need help with something, and they don't understand that just because they have that doesn't always mean they need an actual hand to be held. I mean, it's people without disabilities who have a hard time too.
If I could just add one more thing, I think in terms of aspects of overall care, I think sometimes things that can affect a person's quality of care are sometimes overlooked when it comes to a person that already has a disability, whereas they wouldn't overlook it if the person didn't have a disability, because they figure you already are in this situation.
Right.
Yeah, they don't diagnose, so you can go in and you can have, let's say, chest pains, and they can chalk that up, oh, there's your spasms, but in fact it can be a heart attack or it can be a stroke, and they miss that mark because they're focusing on your diagnosis. Like you should see a person and not a diagnosis. That's what I've always lived that model, and even now I put on my best self. I want a person to see me and not my chair first. I want them to recognize who I am as a person, and sometimes they forget that we are people, right?
Exactly, because I think they feel pity on us because we have a disability, but that's not the case of it. It's that I think they honestly are not educated
Yes, yes.
to see the value that we have and what we do and how we do things with our disability. Because our disability doesn't define who we are. We define what the disability is.
That's absolutely.
I live by a motto: do not pity me and do not praise me for my disability, because sometimes they'll pity you for your disability, but they will also praise you for your disability versus say you, right? And so if you did the same thing I did, they wouldn't praise you for something that I did, right? But I'm no different. I'm just in the chair. So
Right.
yeah, don't pity and don't praise
Yes.
a disabled person.
So I got real lucky that my son's first pediatrician was excellent. So now I don't take anything other than excellent. If the doctor is not good, I move on. I'm not going to try to fix that person. You know, if he or she is not going to hear me, we're not dealing with that. So I just look for quality, and if it takes several doctors, it's going to take several doctors. But one of the things that has been more difficult in getting quality is because my son is nonverbal, so and he's an adult, so they kind of ignore me a little, so I have to sometimes get a little ugly, but it's just part of life, you know.
Now, a true trained medical profession should be able to understand that nonverbal because he communicates.
Oh yeah.
He communicates, and
Yeah.
so you should be trained to look for those nonverbal cues, right? We should be able to communicate in all aspects. If we go in and they see his eyes a certain way, they should know something's wrong,
Right,
The
right.
same way you are, because you're his mother, you are his caretaker, right? So that's one thing that they really need to focus on. And if you lead with like empathy and compassion,
Yeah,
can do that.
and if it's a good doctor or good medical staff, I'll notice that they'll turn to me and ask me, you know, is he understanding or is he in pain, you know, things like that. But when there isn't, where they just want to go in and finish their visit, they kind of ignore all those details. But
you know what? Sometimes I don't like when doctors do that, right? So you're there, you're his advocate, but I think that they still should speak to him, whether he could
Right.
like, verbalize that or not.
Yeah.
So they should say whatever his name.
Right.
Hey, how are you feeling? And then you can answer that. But sometimes they tend to ignore.
Yes.
And that person still thinks they still have feelings, right?
yes,
So they
yes,
need to
yes, yeah.
change the trajectory.
Yep,
Yeah.
yep.
Yeah, because your son is a gift, and the gift that he has is being able to recognize that he can give clues and
Right.
everything.
Yeah. Oh, yeah. If he gets mad enough, he's even said bad words, which I'm like, yes, it was very appropriate. Thank you.
You got a word out, no?
I'll take it.
Yes, high five.
Okay, and we almost reached our 10-minute mark, so again, excellent discussion. Number 3, how does the interaction of the different aspects of your social identity, including disability, race, ethnicity, gender, age, sexual orientation, socioeconomic status, etc., impact communication with healthcare providers? And we do not expect you to talk about all of those different aspects of your social identity, but how does the interaction of any part of your social identity combined with your disability impact your interactions with your healthcare providers?
For me, it impacted it in a positive way because I do have that background. So you can't speak at me. You're going to talk to me. I speak your language. So for me, it's been pretty good, right? And I have seen on the upside where I'll be with someone and I see how the interaction is, and they automatically look at you, and they, especially if you're like in pain, right? They're gonna automatically think that you're a drug, right? You want some pain medication.
So for us, being a minority woman of a certain age and being raised in another country, the cultural part really has impacted because I don't fit the norm of what a lot of our services system assumes that we want. And in my household, you know, we take care of our parents, we take care of our children, we take care of our husbands. I'm not great at that part, but I'm working on it. I don't think I'll ever get there. And sometimes a lot of the system of services don't get that I do like having my son at home. And my children were raised with that mentality too. So they all kind of pitch in, and it's a family dynamic, but it doesn't fit a lot of the norms of what society thinks should happen. And sometimes there's not a lot of respect for it, so we kind of have to fight that system, because that's what we like, that's what we believe.
I think as advocates that we have to actually sometimes show who we are and present how we think and how we perceive things, because sometimes people might just don't understand. Like I ran into a situation the other day. Don't you have a mental illness? I'm like, yeah, but that don't define me though. And don't talk about my mental illness, because it doesn't define what I'm capable of doing. So socially, I have some difficulty sometimes, but then the flip side is there's a good side of because of the treatment team I have. It has been an amazing experience.
I want to say something about race particularly, right? So I had a mammogram done, and I had an abnormal mammogram. So I had a mass at 6 o'clock on the left breast. And so it was a nice size mass. And the provider says, well, black women have dense breasts, black women have lumps. I said, well, you going to check to see if it's cancerous or not? She said, oh no, you come back in 6 months because this is typical in black women. They have dense breasts. So we are sometimes, as a two stigmas, being disabled and African American, sometimes you could they can really miss the mark. And so whatever you have found in your book and says, okay, because you might see 100 African American women with this dense breast, but this African American woman got a lump, and I want you to check it out. So you got to be very proactive. You can't just judge something based off what you're used to, because there could be 1,000 people, but there could be that one person that's different, and then you miss that mark, right?
Yeah.
Yeah, that's like,
Because you chalked it up to a race.
Yeah.
yeah, that's like me. I have high blood pressure, so sometimes my kidney specialist will say, well, African Americans are known for having high blood pressure. That's not necessarily true, because all races sometimes have high blood pressure. I have a couple of friends who are Caucasian, and they have high blood pressure. So it's not just a race thing, it's how we are genetically built.
Yeah, that goes back to seeing the person. You have to see that person. You have to take that person serious, because one mismark, it could literally determine someone's life. Like living with a disability is not a death sentence, but the lack of care can very well lead to it. And that's something that all healthcare professions must remember. So when you're watching this, remember that living with a disability is not a death sentence, but the lack of care can lead to it. So whatever field or choice you're in, you have to really, really put your heart and your passion into it, because you can ultimately cost someone their life.
Yeah.
Excellent.
And that's a good segue, I think, into the second part of this question too. Is there a particular healthcare service area most impacted by your social identity and associated societal perception? So what you've all been saying, about making quality of life judgments, not looking at the individual, and instead of, looking at people as a group, and certain assumptions that people make about that group. Is there a specific area of healthcare services where you get that more than in others?
I think, and for me, I've experienced it more with feminine care, because there's so many moving parts to a female body, like trying to get a mammogram, for instance. Having a disability, trying to do that, you experience. My first experience was not good, because they didn't ask me if I could move myself. They tried to move me, and they were pushing me, and it was a horrible experience, but on the other hand, the second time I went, the clinic was equipped to, make it a good experience for me, to facilitate me having a good, healthy experience that would make me want to come back. So that makes a difference. And then I also point to socioeconomic status. If you have state insurance versus private insurance, sometimes you get horrible care, not let alone you may not even be able to have a private physician. I have had instances where I wanted a particular physician within a clinic group that took my insurance, but they just felt like they could give me any one of the people in their practice as opposed to the specific doctor I asked for.
And that happens a lot when it comes down to Medicaid and Medicare and private insurance. I'm big on that in my platform. I feel that people with private insurance, and I'm one of those individuals with private insurance because I was hurt at work. So I feel like, let's talk about a shower chair, right? And then really big on the shower chair. So some people need a specialized shower chair and a commode to have dignified care. So I can properly get showered, properly bathe, right? So I remember I have that insurance, but I remember my home wasn't accessible enough, so I had to get this tub bench. And I felt like a prisoner. Like I ended up with all these UTIs, skin breakdowns. The shower was like, what did I do to have to get this shower? And so now I have this specialized shower chair and commode, and I think of individuals that may be in the same condition that I, or even worse, and they're degraded to this bench, and they say, oh, this is a luxury, when it's a fact and necessity. I feel that if more healthcare professions advocated with us, right, we build this alliance, and we build an alliance, and we put people at the very center of our endeavors, I believe that we can truly have overall better quality of life. We really can. But it's going to take the healthcare professions joining us to say enough is enough, because the federal government, they are the very foundation for care, right? They have it through their legislation, regulatory, their measures, their policies. But it takes the healthcare professions on all aspects, doctors, nurses, caregivers, everybody to come together. And when we come together, we have this meeting of the mind, we can truly have a better outcome, because our actions today will shape the future of caregiving and caretaking tomorrow for our future. So we got to get it right today.
I agree with you. When my son was only on Medicaid, the difference between, because now he's on Medicaid and my private insurance, the quality is better. What I have noticed, and this is silly, but what I have noticed is he has his father's last name, which is Davalos. And I have my husband's last name, Hernandez, which is like, I'm like, really? That's so boring. Everybody's a Hernandez or a Lopez. And I noticed that when I was Davalos, I got better services
Wow.
than being a Hernandez.
So they think like Mexican or something?
Yes.
Isn't that something?
Yes, and a lot of times people assume that I'm on Medicaid because I'm a Hernandez.
They do that.
Yeah, and it's
African-American?
just my last name.
As African American, we experience it all the time.
All the
We
time.
experience it all the time. Like you literally see this dark colored skin.
Yeah.
I named my daughter Jody, and I named her Jody because I don't want her to. I want her to be judged by her identity, not look at a piece of paper and say, "Oh, that's Shantae. She got to be black." No, I want you to see a person, and they do that far too.
Oh yeah,
often.
yep.
You are absolutely right. I get overlooked a lot of times, and I be like, huh? What you mean? So sometimes I blow it off, then other times I really stand up and advocate, because their misconception of a stigma of me, which is not true.
Never blow it off. Use it as a teachable moment. Never accept that you make way. You let them know I am Antonio. You never don't blow it off, because when you silent, you agree. So never blow it off. You can properly teach somebody effectively. You never have to be aggressive when you're quiet spoken and you're polite. People tend to listen. You can really teach. I have taught a whole lot of people. When in reality, I want to go off, but I want to use that moment to educate, to make it better for the next person.
Now, when I speak to my students, I always be there, and they ask me, well, Mr. G, how is this like, and how is that like? And I'd be like, well, you gotta be calm, patient, and everything, because those kids I work with, they also get overlooked because of their disabilities. And I'd be like, that's not who they are. It's about how you perceive yourself and how you handle things sometimes. But you're right, I do get a lot of that, but sometimes I just blow it up even though I should.
And I'm gonna jump in. I wish I didn't have to cut this out because this is wonderful. But we want to get through the rest of these questions because you all are giving great responses. So number 4, what social environment factors most impact your ability to access healthcare services and lead a healthy lifestyle? Social environment factors include access to quality education, appropriate medical facilities, safe housing, transportation, job opportunities, nutritious foods, physical activity opportunities, and clean air and water. So what are the ones that affect your ability to lead a healthy life and access healthcare the most?
So, for me, I think the most thing I've experienced is where I live in the city. I live in a food desert. So if for whatever reason I can't drive that day or I don't have somebody to call, then I'm at a disadvantage because the store is not right up the street. I think that's it. And then too, housing, not just safe housing, but accessible housing, because being able to get out of the house to get to a medical appointment without endangering yourself is extremely important. And that's something that we need to advocate more for.
You have to really have empathy and compassion to see people for who they are. Like you got up this morning, you dressed yourself, right? I didn't. I had to have someone physically help me get dressed, help me get out of bed. But I had that option. There are so many people who do not have that option because they are on Medicaid or Medicare, don't have the access. So people are going days without a shower, something that's dignified that everyone should have access to. It's like almost like it's a luxury and not a fundamental right. And it should be a fundamental right. And so for me, fortunately, I got hurt at work, but unfortunately, I broke my neck.
For us, it's quality of air. I live in the city and I have a lot of eye allergies. I actually have, my tear ducts are clogged because of allergies and contamination, and it is a pain, pain. It's quality of air for us.
I live in an apartment building that smoke. The cigarette smoke is horrible, and it affects my breathing.
Yeah. I'll also speak to, it says here physical activity opportunities. So I'm going to take this opportunity to talk about unnavigatable sidewalks and streets. Because if you can manage, if you have an accessible home, and I'm fortunate that I do, where I can get in and out at my leisure, but getting up and down the street, that's a whole nother thing, because the sidewalks are impassable. I have a park right around the corner from my house that I can go to, and I can't get there. When my son was little, taking him to the park, I had to wait for somebody else because I couldn't traverse the sidewalks.
and that affects your ability to use public transportation
Transportation.
to get to the doctor.
And again, that goes back to the community too, right? So when this area, that area, and every area is different, right? So I may have access to something that you don't, right? And it should be this 2024. It's just
Right, yeah.
2024.
Exactly, yeah. The quality of life should be easier
Much
for us
better.
to have a better quality of
Yes,
life.
it's
Yeah.
like we all should be equal. You know, we shouldn't be equal. I take that back because each of us are individuals, right? So we have, I may have a need that you don't, but people should be a priority. People should be a priority, and then we put people first over the profit. We put people first over saving money. We could save some lives. The biggest key is to hold people accountable.
Yeah.
So we hold people accountable. Doctors, nurses, the government, self. You have to hold yourself accountable too. So we do that. Very good.
Okay. All right, so we'll go ahead and move on to number 5 then. What practices have healthcare providers employed that made your experiences receiving healthcare services more comfortable and inclusive?
Oh, I could speak to, so I think we have the same doctor.
I love my doctor.
Do you see Dr.
Yeah, I
Matar?
love my doctor.
Oh, they're phenomenal.
Yes.
They make it easy for you to come in. Like they have made it. It seems like they made it their
big.
mission to create an inclusive and accessible environment. So you're not on edge going in and out. Like sometimes you go somewhere. I know for speaking from personal experience, I'm on edge. If I have to fight to get in and out of the door of a place, I'm already because I
Yeah.
spent 5-10 minutes trying to get in the door. So being able to roll in freely
Yes.
and get to where I have to go without having to navigate. People think it's simple, but putting signs, posting wayfinding signs so that if you're in a rush, you can see where you're going. That makes such a big difference.
And this particular doctor, he factors his patients in every decision that he makes, right? You don't make that decision alone. You are included, you are at the table, you are included in those decision making. So he truly lead with empathy and compassion. He truly see that person before the disability. He understand. He, like you said, the room is big. The room is big. I can turn my chair around, and they literally they lead with empathy.
Yeah,
I could say-
What about communication?
Oh, communication is
phenomenal.
yes. Like you're not gonna meet this. Every doctor is not gonna be like this because I had some doctors that try to talk at me. Not gonna do that because I know HIPAA, I know recipient rights, I know abuse and neglect, I know the code of ethics as a healthcare profession, and I'll make that known every time. But this doctor, you don't have to do that. You could simply be yourself. He's going to ask you, "How was your day?" And that's the first thing you should do. You should get to know your patient. You should know your
Yeah.
patient. You shouldn't go say, "Oh, Shantae, date of birth." You should not only know me by my diagnosis, my name, my date of birth, and my date of injury. You should know me by me.
That's like my primary care. She's awesome. She made sure I receive the excellent services that I get. She always, every time, like I could be the last person, and she'll push me up front to see me to make sure I'm all right and everything, and to make sure all my medication is accurate, and making sure I'm receiving the right provided services that the office is actually giving.
So taking into consideration what other types of accommodations you might need to make sure you're fully taken care of, right?
Yes.
Yeah.
So like I said in the beginning, my son had a very good pediatrician from the start. So it wasn't difficult. I started working at a nearby hospital for children, and I was like Clint Eastwood. I got to hear the good, the bad, and the ugly. So I knew who to stay away from. I knew who was the best of the best, and I just surrounded ourselves with quality of care.
My problem is never at the doctor's office. It's in the hospital.
Yeah, that's a big one.
Mm-hmm.
Do you,
Yeah.
do you find that?
I do. Because a couple times I went to the emergency room and the physicians leave you. Like, if I have to go to the restroom, they'll help you on, they'll put you on the table, and they have moved my wheelchair so far out of the way that I can't get to it. I can transfer myself, but if my wheelchair is across the room, I can't get up and get it. So, that has created difficulty for me.
Yeah.
But speaking about something you said, Julia, about working in the system, I don't think a person should have to have proximity
Mm-hmm.
in order to get their needs.
Right. Yes. Yes.
My mom, when I was diagnosed, my mom was able to get me the correct diagnosis because she worked in a hospital where the doctor, one of the main doctors there, ran a clinic for individuals with neuromuscular disabilities. It made all the difference.
Mm-hmm. Mm-hmm. But everybody should get that same.
That's right.
Absolutely.
Yep.
Absolutely.
Yeah.
That's right.
Yeah.
Okay, any other comments before we move on?
Let's go back to the hospital. So it's not only like a physical. They'll probably seeing you can go in there with one condition. They'll send you an orthopedic when they should have sent you a neuro surgeon. So I think that sometimes they lack that training. They're used to seeing like a broken arm or broken leg, but then you have individuals coming in with some real conditions that requires specialized care. You tend to get don't let me go to the hospital, ER. I don't want to go to the ER. I want to go to. I would like to have a scheduled appointment. The ERs are absolutely horrible for me. I have extremely bad spasticities. I have a Bapplic pump. I wear a medical alert to let them know exactly what they can and cannot do. I let them know where I'm capped at. I've had someone, I was getting an x-ray, and the lady says, "What do you have in your pocket?" I said, "I have no pockets." She said, "What is that?" I said, "It's a Bapplic pump." She asked me, "Can I take it off?" I said, "Well, no, it's inside of my skin, and there's a catheter in my back, in my T6. I said, "I wear a medical alert for you to know." So it made me feel very dehumanized, right? It was like almost like, ew, what is that? Like, they really need some oversight when they're going through these education trainings. So I'm like very appreciative that you decided to do this, because someone's going to see this, and as a result, they're going to know how to best treat the disabled, not just the 6 of us sitting here with these conditions, but all people. My platform, bridging the gap between caretakers and the disability community.
Yeah, and I would say not even just people with disabilities, because there's so much diversity within disability.
Yeah.
But it has to be individualized care.
Care.
It
Yes.
has to.
Yeah.
Person-centered.
Yeah.
Truly person-centered. Yeah.
Absolutely. Okay, and we're moving on to the final question. And this is the fun one. If there was one tip you could share with healthcare professionals to engage with people who have disabilities more respectfully and accessibly, what would it be?
Don't assume.
Don't assume.
I would say speak in understandable language, understandable English, where I think medical staff need to be more patient and not be in such a hurry, and explain to us what's going on, what can we look forward, the possibilities of something bad happening, or when we know that something is working, because it's very frustrating to just get a little bit of information and then you're worried. You're more worried than sometimes when you went in, because you don't have enough information. But giving you way too much information, of course, is overwhelming. So there has to be a balance, but it goes back down to training. If people were trained better, it would make a big difference. It would make our lives easier. It would make their lives easier. You know, it would be a win-win situation.
I think leading with empathy and always listening. That would be the 2 tips that I would give any medical professional. Be empathetic and listen more than you talk.
And I would say be intentional in your care. If you are intentional in your care and it's purpose driven, that empathy and that compassion, that communication, that understanding can break those barriers. So I would say literally care with the purpose.
Get to know your patient, find out how their day is going, find out what services do they need, and how you can be accessible to help them. So it's basically get to know the patient.
You know, and I will second that. I think that being holistic and, you know, not just providing healthcare services, but being an advocate for people to live a healthier life, looking at it as a bigger picture.
Yeah.
Doctors should be their patient's advocate on all aspects.
Yeah.
Any final comments, thoughts?
Great job monitoring,
Yeah.
doing this. Yeah, yeah.
Great job.
Thank you.
Awesome.
Thank you. You made it extremely easy. This was the easiest. I wanted to jump into the discussion. I'm like, I'm the facilitator. I can't do it. So, but it was wonderful discussion, and more than that, I think that this is truly, truly going to be an effective tool for healthcare providers. I think this is going to make a difference. This is an original thing we did today.
Wow.
So be proud of yourselves.
I appreciate it.
I think we all should give ourselves a round of applause.